Welcome to Understanding the Exceptional Mind podcast. I'm Dr. John, and today's conversation is with Dr. Jason Porter. Dr. Porter practices naturopathic medicine and has been doing so for 22 years in private practice. He's focused on working with patients that have chronic or debilitating illnesses for which other modalities of medicine have not been able to identify treatments or cures. Dr. Porter is a graduate of Sonoran University. He's board certified in neurofeedback. He is an incredibly intelligent and wonderful individual with an amazing practice here in Arizona. One of the things that makes him amazing, as listed as his premier accomplishment, is the fact that he is father to 5, including 3 who are adopted, and he also has 5 grandchildren. Dr. Porter is a brilliant individual, and although I'm still working on my interviewing skills, our conversation, I think, will be fascinating to just about anyone. We go into a variety of topics. There are no guardrails here. We talk about his passion for helping others and how he parlayed that into naturopathic medicine. We talk about the role of sleep and diet and exercise in some of these diagnoses, ADHD and autism. We talk about why and how some of these diagnoses that I just referenced are on the rise, what may be behind that and the sources behind that, whether it's foods, whether it's vaccines, whether it's over-the-counter medications. We go into all topics. He is a fascinating individual to talk to, and I really hope that I will have an opportunity to talk to him again. At the end of the day, I left with an understanding that naturopathic medicine is really a hybrid form of medicine that we need to get to, because those who practice naturopathic medicine can dip into the more traditional modalities of just kind of a narrow lens of what is happening here and how do we quickly treat that. And that oftentimes is through pharmaceuticals, as we know. And so they can dip into that realm in naturopathic medicine, but they start with the whole human. They start with considering those factors like allergies, like exercise and diet and sleep habits, like gut health, things that are fundamentally important to the human experience. And they try to identify factors in those realms that may be contributing to the behaviors that we end up diagnosing with these various words. So it's a fascinating discussion. Agree or disagree, join the conversation, because the more we communicate, the more we talk, the more progress we make. At the end of the day, it is our understanding that leads to our empowerment. For more information on Dr. Porter, we'll put a link to his practice below. And with that said, I hope you enjoy the conversation. We'll see you on the next video. Welcome to Understanding the Exceptional Mind. I'm Dr. John, and I'm extremely excited to be joined by Dr. Jason Porter, who is a naturopathic doctor. And a remarkable individual, exceptional individual from head to toe, inside and out. I say that because I met Dr. Porter, it's been, about 2 years now?
Yeah.
Somewhere in there, it's been a while. And when I met him, he came to our practice and he talked about what he was doing at his practice. And everything he was saying resonated with my practice partner and myself from the standpoint of he had a very open approach, or you have a very open approach to understanding the realities of human behavior and the human experience. And you had talked about this idea that you had had your own experiences working through systems when you have children that are neurodivergent, and some of the frustrations and that you encountered while navigating those systems. You had already had those experiences, and you had talked about the idea that parents were their children's best experts. And so from that, through our conversations, it was very evident that the thing you had to begin with was an open ear, because you had had experiences that mirrored some of the experiences our families were having. And then when you started talking about your treatment modalities and the methods you were using to kind of investigate the sources of behavior, it was absolutely phenomenal. So the reality is, I can't think of a single patient I haven't sent your way, because what we do here is we look at what's happening in the brain, how is the brain developing, and how is it functioning. And we can give parents kind of an overview. But when it comes to what do we do next, what are the tools that are needed for effective interventions or for treatments, that's where you come in. And in our interactions with you, I knew there was simply no one better. So before we get into your professional career, and this may overlap at some level, I wanted to ask you, one of the things I've come to realize over time is that people that are exceptional and really at the highest levels in their profession, that's born from a passion. But passion isn't developed through academic experiences. It's not something you learn or just sort of magically appears. It comes through personal experiences. So that's where I wanted to start. Where does this passion that you have to support the individuals you work with, where does that come from? Was it something that happened throughout your childhood, as an adult, in your professional career? Where does your passion to support others come from?
Oh, that's such a good question. And hey, thank you for inviting me. I love partnering with you guys, and you are so talented, and just recognize you have so many gifts and abilities here. And so just it's a privilege to be here with you. It's a good question, and it's hard to appreciate, but we all kind of grow up, and certainly I had I think good parents and great grandparents, but I spent 2 years on a church service mission in Germany, and I learned a foreign language, and it was in a foreign country, and there it really worked with people and trying to meet their needs and informing them about religious ideas and Christian ideas, and from there I really gained a sense of just the ability and the power of people being able to help others. And so when I when I returned from Germany at 21, I began my education here locally. I was from Mesa, and began a business major, and I accredit the classes I had and the instructors. They really showed me what it would be like to be in business, and I got a good sense of that. But it was interesting. It wasn't satisfying, and so I took some health courses, and in the process of that, recognized and had again some good feeling about wanting to help people in that realm. And so it opened my mind to some different ideas, and as I investigated that, I began to and changed my degree to exercise science. And I got a job working as a trainer, and not knowing much, but in that little knowledge I had, I was instructing people on diet and exercise. And after a few weeks, people would come back going, I feel so much better. My energy's better, my mood's better, my focus is better.
Right on.
And from that, I began to recognize that excited me. But what I didn't know then was there's not a lot of future in exercise and science and health, and so with the encouragement of my wife, I decided to go to medical school. And now I'd grown up fairly natural-minded, and so I had recognized that a lot of medicine sometimes wasn't listening to people, and so I wanted to be the kind of doctor that was more proactive about educating people. And so I looked for a different type of medicine that would support those ideas, and came across naturopathic medical doctors and that type of training, and got excited about that, being able to teach and help people. So I've always been in that, I guess, in a way, wanting to help people feel better, recognizing that a lot of people that was a need that people had. They didn't know it, and it wasn't being taught, and maybe that's one of my gifts. And I don't, it's not in a braggy way, just saying I can see the needs that are out there, and just say, well, no one's meeting that, and let me see if I can fit into that mold and help people.
That is beautiful. One of the things we tell parents, as I mentioned before, is that parents are always their kids' best medical doctors, best psychologists, best psychiatrists, best neurologists. They know their children better than anyone. So therefore, a good practitioner, a good person to partner with in the medical world is somebody that can inform them as to what their options are and help them understand the true sources behind whatever it is they're looking to change. So in the world of psychiatry and psychology, ultimately, we're trying to discover the sources of a behavior that we're looking to change. And that again is really where you stood out, and what really just makes you so extraordinary and exceptional is you begin this process with an open ear, and then your goal is to, through a process of information sharing, to help parents understand first and foremost what may be going on, and then that allows them to select the best treatment option. Uh, and don't let me put words in your mouth, but for this is what I always tell parents. We want to start with the big four. If we're looking to change a behavior or an internal experience, we know we cannot have a behavior without a body and a brain. You can't have attention, or you can't be impulsive. You can't have an emotion. None of those things can occur without a body and a brain. So if any of those are sort of out of balance, or we want to change them, we have to start with the body and the brain, not necessarily Ritalin or Zoloft or whatever it may be, medication. We need to look at what might be out of balance in terms of the body and the brain. And so the big four for me are sleep, exercise, diet, and sensation. And I think that's where I really like you and your practice and your paradigm of thinking to be the first stop for parents. So with that being said, what is the role that you see? Actually, let me back up. So we deal in the psychiatric, psychological world. So we're fundamentally, when a family arrives, when we work with a patient, it's some aspect of their behavior that's become challenging, or maladaptive, or we simply want to change it. And there's so many disorders that are on the rise, a lot of them regulatory, ADHD and autism spectrum disorder, and various things. So I always recommend we need to make sure we're not missing something in the body and the brain, and then I send them your way. So with that being said, this incredibly long, drawn-out introduction to this question, are you seeing patterns when somebody's been diagnosed with ADHD or autism spectrum disorder? Are you finding there are actually physiological sources or neurological sources that may have been overlooked through more traditional or the more medical, pediatric or pediatrician, psychiatrist domain? Are there sources to these conditions, these diagnoses, these behaviors that are being overlooked? Are you seeing any patterns there?
Oh, absolutely. Besides seeing the patterns, they are reported very well in the research, and without sounding, say, critical, we're trying to have the right conversations, and to have the right conversations, we have to acknowledge where we're good at and what we're not good at. We've gotten good at describing things, even labeling them. Sometimes that's for coding and insurance purposes. But we've lost the ability somewhere in there, it seems to me, to get to the root issues of why things are happening. And you say, well, we have a behavioral or some form of dysregulation. Is it, say, caused by a dietary issue, say like an allergy to dairy or gluten? And again, without sounding too critical, we've stopped asking those questions.
100%.
And we haven't just stopped asking the questions. We have to recognize that in the last, say, 50 years, part of my grandparents influenced me. My grandmother, when I was a grandchild, remember giving me an open-faced whole wheat slice of bread that they'd made with avocado and tomato, salt and pepper. I mean, that's a granola or as hippie as anything I've ever seen. And I don't know that they were hippies, but it was very natural. And that's popular today. But then you're like, Grandma, what are you feeding me? She goes, this is healthy. But we've strayed far from that today, when 80-90% of the food that we consume has been manufactured. And yes, maybe we know what's in it, and there's some of it's been replenished with certain nutrients, but we have foundationally have started reacting to many things. So I think our diet and the quality of our food has changed. There's questions about whether, and I say questions. Some ignore it, some accept it, but pesticides and all the things that are put in our foods are sprayed on our foods to control fungal and pest. if that is getting into our food, how is that affecting us? And again, I think those are foundational issues. So I think that we have begun to ignore the fact that our environment is starting to, I think, hurt our kids.
Absolutely.
So what we're eating, what's in our food, what's in our air, what's in our water. We are just barely starting to understand, even just say, when we say what's in our air, the electromagnetic fields, what's the electronics and EMFs, all these things, how are they affecting our kids?
Yeah.
And so we're having discussions, and a lot of us are like, we don't know yet.
Yeah.
But it's been a food, a diet, and these things have been evaluated to affect people in many ways.
Yeah. So let's take a hypothetical. We'll start out with Johnny. Johnny comes in, been diagnosed with ADHD. Now, in a MD type world, we would understand that those are the behaviors, inattention, impulsivity, whatever. And typically the treatment modality is, well, here's a stimulant medication, and let's see how it works. So they come to a clinic like yours, or they see a naturopathic doctor. And so someone that's been diagnosed with ADHD, are you finding that when you run these tests related to body functioning, body health, therefore brain health, they are absolutely connected. Are you seeing hits around, Johnny actually has an allergy, and if we eliminate gluten, let's just say, we're going to see behavioral improvement. So you are seeing those relationships out there?
That's correct. And more and more familiar. And if you get on the internet, and I know a lot of people are using AI and chat GPT and such, and it's very simple to say, do the gut and the brain, are they connected?
Yeah.
And it's very clear
100%.
very quickly to be educated and informed today. 20 years ago, that was very controversial, right? That's weird people think there's a connection there. But right now, I think everybody accepts today that there's a gut-brain axis.
Yeah.
And that, in fact, we have more nerve endings in our gut than we do actually in our brain. So who's actually in control? Well, we know the brain's doing stuff, and it's very valuable. But the brain is both hardwired to the gut and chemically wired. So if, say, for example, someone consumes gluten, and they're reacting, and it produces certain proteins, well, those proteins can actually cross into the bloodstream, actually end up in the brain, and create irritation, inflammation. That creates what? Agitation, hyperactivity, even increase impulsivity.
Yeah.
You remove the gluten from the diet, those proteins reduce in circulation, the child's behavior improves.
So important.
Sometimes some of those things may produce different, the immune system has many angles in which the brain will interact with it. So, maybe there's histamine involved. I remember I had a case of a child that had impulsivity or hyperactivity whenever they'd eat certain foods.
Yeah.
Some of it may have been due to the colorants in it, red dyes or such, which have been brought up in even our public attention in this current discourse today. But we would then follow with a sedating antihistamine, Benadryl.
Interesting.
Well, what's interesting when you do that in a child like this is you'll give them 12.5, 25 milligrams, even 50 milligrams sometimes of Benadryl, and the child doesn't fall asleep, but the behavior goes away. So you begin to recognize that histamine, which is, yes, part of the immune system, but is also a neurotransmitter. It does affect, it does cross the blood-brain barrier, it's in circulation. So it creates agitation, irritation, impulsivity, behavioral challenges. So that's just a food. We're talking about foods, but we're talking about, there's many other things in our foods today. For example, we're beginning to evaluate more recently even additives, which are considered safe by the current U.S. FDA, such as gums, colorants, preservatives. So these are things that are in a lot of foods.
Yeah.
And we're eating them. We all think they're safe.
Yeah.
But I think more and more we're reacting to things that we don't know. And I think we're all allergic to something.
Yeah.
If I eat enough things, eventually I'll find something that makes my throat itch, or creates a rash, or causes eczema, or an irritation in the brain. But in a developing brain, that's can be more disruptive, particularly if they're consuming it on a daily basis. For some reason, we don't get allergic to broccoli, it seems, that often.
Yeah, isn't that weird?
Isn't it?
And yet,
it seems to be gluten and dairy.
That's the hardest one to sell sometimes. But that's such a great point. And the point being that, we talk about here quite often that the behavior is a symptom, the brain, the body is always the source. And this idea that we go from a behavior, well, we're going to call that ADHD, or we're going to call that dyslexia, we're going to call that autism spectrum disorder. Well, yes, that's a description of the behavior that's sort of a word that tries to encapsulate the behaviors. But the source is everything. And that's what I tell parents, that we've potentially overlooked some sources. If we just go from the behavior to the diagnosis to the intervention, we've actually not focused at all any attention on the only thing that really mattered, which is the source, the brain-body connection. I've had multiple scenarios where we're going to go back to Johnny, diagnosed with ADHD, and the behaviors are absolutely there. You can go down the checklist. But I'll say, you know what, Mom and Dad, we're going to get rid of this idea that the word is what's important, because the word describes the behaviors, but we know we can't have behaviors without a brain and a body. So let's dig a little bit deeper. And fast forward, Johnny, who's been prescribed Ritalin and a couple other stimulants that haven't been working, really had diabetes all along.
Yeah.
So it wasn't the stimulant that was needed, it was insulin all along. So why did that happen? Because right now, especially in the sort of traditional world, if you will, we do this investigation where we say, well, my eyeballs will look at the behavior. We're going to have you do a couple of checklists. That behavior aligns with this word. This word means this intervention, whether it's antidepressants or stimulants or anti-anxieties. And we've literally gotten to the point where we're ignoring the only thing we needed to look at. And that's why I love what you do. I love your paradigm of the analysis of hitting the realities of the brain-body connection first, not to say there aren't options if we need to get there in the more traditional realm. But I just think that's so critical. What about other things that you might be finding, that are more common than people might know? Just as examples, like Lyme disease or fungal or mold exposures, anything really kind of jumping out in that area?
So many. That's another
whole nother conversation
or two.
We'll get there.
What's interesting, and you may observe this, and as you see a variety of patients, I mean, part of my experiences we've discussed personally outside of this interview is when my youngest adopted daughter developed a set of symptoms that included diagnosed as anxiety through the psychiatrist, OCD, ODD, which is oppositional defiant disorder, reactive attachment disorder, ADHD. It was very complex. At the time, they wanted to give medications, and it didn't seem right to me because even I could tell, well, this is very confusing. What is going on? We treated what we could observe to be assumed to be the most important thing. Since she had been adopted and was in the foster system, we thought it must be reactive attachment. So we moved forward with that, which required a lot of therapy. So my wife and I engaged with our daughter, with the therapist, to treat that as best as we knew how then. It was years later that I recognized that my daughter had PANDAS, which is that autoimmune inflammatory disorder in the brain from many things. Now, back when 1999, 98, when Dr. Sweeto discovered that, it was strep that was discovered to be crossing, or antibodies to strep crossing into the blood-brain barrier, creating that inflammation that would create OCD, anxiety, tics, extreme fears. So I didn't know anything about that when I was a young doc. I treated adults. I never intended to treat kids. In that process of learning to treat her, I realized, whoa, these kids are struggling. I met more kids and realized, wow, this is a untapped issue. So going back to your question, it gets challenging today. But so when a child comes in, they might be diagnosed with ADHD or they might be autism. Some of them are having PANDAS as well. We see that fear, we see that anxiety. So I start thinking of many things. So for example, vector-borne illnesses like Lyme and Bartonella, in adults they create anxiety, OCD, brain fog. Well, a child rarely is going to report anxiety or brain fog. Although they'll report like fears. I want to sleep with you. I'm afraid someone's going to break into the home and kill us tonight. You're like, well, where'd that come from? We don't watch violent TV shows. So you start seeing these irrational fears come into play. And so we know those infections. So I test those. We know that, for example, now mycoplasma pneumonia. The first cases, I think, reported in the U.S. were associated with veterans from the Afghan war.
Interesting.
And so But it is now common. We see it in teenage girls, often causing autonomic disorders, POTS. But in children, it can create this inflammation in the brain as well. We have seen mold toxicity. That's a new one.
Yeah.
That was discovered and or reported by Richard Shoemaker. Probably first reports 2006, 2010. I didn't learn about it till about 2012 to 13. But it's answered a lot of questions for us, for adults. But if our kids are genetically susceptible to toxins, which many are, that they will create inflammation in the body, but also the brain as well. What else do we find? Well, of course, the food allergens we mentioned earlier. We evaluate for gluten and dairy often. There is more and more often, and this is surprising to me and others, we even evaluate for autoimmunity, Hashimoto's. We've seen 9-year-olds with Hashimoto's.
Wow.
That sounds crazy, right?
Yeah.
Usually that was relegated to, say, adults, 40s or 50s. But now we see it in teenagers, and even I've seen kids under 10. Celiac disease, Hashimoto's, and even indicators of pre-lupus with positive ANAs. And so those are markers. And so all that, when you do all those labs, they start to give us a clue of like, hey, what's going on in that immune system? And of course, we get a real quick clue sometimes. Even IgEs, allergies, right? So even environmental allergies can increase. I liken this to that idea of I think that's where we struggle today in medicine, is we try to simplify it too much. A patient has a complaint, and we run a few labs, and we go, this is what you have. But to me, that's like looking in the question, answering the question is there a fire on the mountain? And then you put a blinder on, you look through a pinhole. And go, well, I don't see anything. And that's what we do in medicine. But when you take the blinders off and you see the full view, you go, whoa, there's a fire on that peak. Not on the others, but on that one. And so I liken it to a lot of what we try to do and have to do is throw a big net. And we're not looking for a minnow. And when you only do one lab or two labs, you're fishing for minnows. What you want to do is find the thing that's really creating disruption in the system. And so you have to throw a wide net and test as much as you can. That's reasonable. And that the insurance allows, the parents are willing to pay for. But the more information you gather, you've honed it in, and we begin to find those things that are disruptive. And of course, not one person on this planet is really like another, right?
Absolutely.
We're all so uniquely different. And when it comes to like disease and how people are expressing different symptoms, we have their personalities, their characters, their home environment, how they're being raised, but we have every child is different there, and so no case is ever quite the same. So the more, as you've learned, the more you study, the more you evaluate, the clearer it becomes and what's going on with that individual.
And again, this is the reason why I literally ask everyone to go see you, because the wider the lens you have, the more you're able to determine sources that may be missed. And I find that a lot of the families, by the time they arrive at my practice, they're pretty beaten up in the more traditional system because they're not listened to. And then when you have that narrow pinhole view and they say, well, it's not this, because this is the most likely statistically. There are some statistical possibilities or some sources that are statistically unlikely, but it's not even worth investigating them because they are unlikely. But when you start with a lens or a paradigm that says, we're going to consider everything. First thing we're going to do is listen to what the experiences are. And then anything's on the table, and we'll find the directions, because we're going to have to peel back some layers, because so many parents say, they've gone here or there, and the doctor, has said, well, everything looks good, or you're just overly concerned. We tap their knee, they reflex, everything is fine. It can't be anything neurological, and at the end of the day, no parent wants something to be wrong per se, but parents always recognize this isn't quite going the direction we want it to go. We see our kiddo putting a lot of effort in, and they're still dysregulated, or they're still not learning. So there has to be answers to these questions that haven't even maybe been considered. So in UCOM, and that's why I love this idea that we start with the realities of the brain-body connection and make sure we consider all sources there first. And then we do have access to those tools that can be helpful across the board, whatever those may be. But we need to consider the natural mechanisms first before we go anywhere near throwing something in the tank via medication to alter a human experience or human behavior. And so that's what just really separates your field and you personally, along with your passion and your just amazing way of being, from the experiences families have in a more traditional setting. I always get reports back that they've had an incredible experience and they now have answers and hope they never had before. So I can't thank you enough for doing that, and I really want anyone listening and watching to understand the value in this idea that behavior can't exist in a vacuum, and if we're seeing a behavior, something's causing it. So find somebody that's willing to pull back all the layers, listen first and foremost, and then consider any and every avenue to figure out what is the source. And so that's I love that you do that, and I can't thank you enough for helping all the families you've helped. What about...
Well, can I comment on that a second? And you made me think as you're describing that, another way that we look at it. I mean, I was trained as a doctor as well as you are, and to look at the system as far as the body is systems. You got the nervous system, the digestive system, the skin as a barrier. We have these different systems. And we have different specialists sometimes that focus on the systems. But when you're looking at a whole person, you have to take the whole body approach. Absolutely. You have to understand all the systems and how they interplay. Part of what we've discussed, and I think a lot of people recognize, because they're smart when as we start to discuss these, that a lot of these things that are, say, in the brain that you're evaluating, it's in the brain. Mm-hmm. Well, sometimes the brain is broken in some way. Mm-hmm. You know, maybe there's some cross-wiring. Right. Maybe some network issues. Right. But a lot of what we do see is arising from irritation in the brain via inflammation. Right. Inflammation. A lot of that is arising from then the immune system. Yeah. So interesting. Now, probably, and again, part of your job, and I don't do your job well, you're phenomenal at it, so you're good at evaluating what's going on in the brain and the networks. Like, is some area not communicating, and or are we struggling in one area of the brain? That's not my specialty. My specialty, technically, which is complementary to yours when we put them together, is to evaluate really the immune system. So I usually start, say, with the gut, and I start with the idea of infections that are hidden and things that we react to in the environment, like food. Yes, food's something we eat, but it comes from the environment. It can be clean or it can be reactive or toxic. And so, but it's all from the foundation of it. It's all about the immune system and how it's reacting to it. Mm-hmm. And that would make sense for a lot of things. But if there were no immune reactions, we probably have fewer brain issues neurologically. 100%. Probably. What percent, we don't know. Yeah. But I think it would be less than 50. Yeah. Probably less than 80. Yeah. And then we'd be dealing with more specific, like genetics. And that's, again, in a doctor's office, when a patient comes, you're trying to evaluate, is this something life-threatening? No. Is this something that could be genetic, and I don't have any ability to fix or repair? It's a permanent condition. Or is this something that seems to be, is this normal behavior or is this abnormal? No, it doesn't quite fit, and go, all right, let's try to figure that out. But I always start with the idea in mind that the immune system is playing a major role in that and how the body's expressing. I'm going to throw this out there. You're a real doctor. I'm not. I'm no. You do the real stuff. That's just the reality. But here, you know, I have come to learn anecdotally that it is inflammation is going to be the answer to a lot of these terms that I end up using, whether it's ADHD or Tourette's or autism spectrum disorder, depression, anxiety, some aspect of the brain. The reality is any of those, at the end of the day, something in the brain has developed and or is functioning differently. And many times those differences are born from inflammation, and that inflammation can be acquired, of course, through different mechanisms. Sometimes it's a more functional, that would be more genetically oriented, and that would have a different intervention protocol. But at the end of the day, I'm certain, and I am a very strong believer that in most cases, it's the regulatory systems of the brain that are operating differently. We have the sensory systems that take everything in, integrate it, store it. That's where we think. We have emotion. That's where we learn, communicate. All that stuff happens in the sensory system, and then we've got a regulatory system that must manage the activity there.
And what I am finding is that the regulatory systems a lot of times are the ones that are being impacted in some way, shape, or form, which you now begin to peel back the layers and figure out what may be impacting that. And then the final output that we look at here is we have sensory, that's sort of, again, the cognition and the emotions and the human experience. That we have something's got to regulate it. So we have a regulatory system. And then we have a motor output system. And motor output system is behavior. Behavior is only movement. Even my speaking is behavior, but it takes a process of movement. And so if we have a paradigm of diagnosis where we only look at the movement systems and the behavior, we're missing so much of what's actually happening in the brain. And we're also missing so many opportunities to identify why is that experience or why are those behaviors occurring. And so we're so limited in the psychiatric and psychological fields by this idea that we use subjective criteria, and it's always behaviorally based. And so as a quick example, if I were to say, based on your behavior, oh, you're interested and you're enjoying this, but internally you could be thinking, let's pick it up here, let's go, what is he talking about? I have no idea what actually is happening internally. I only can judge your reality through your behavior. But you offer opportunities to go in at a deeper level. And so I do a lot of talking, and I'm very dysregulated. You've known me for a while now. So let me jump back for a moment to, can you explain to anyone watching, listening, and myself, what really is the difference between a naturopathic doctor and a medical doctor? What are the main differences that people should know about there?
Well, foundationally, we are trained the same.
Yeah.
Some would argue that's not the case, but it really is the case if you view medical education and training. So we have to evaluate when a patient comes in, all disease. Do I need to refer? Is this something I can handle?
Mm-hmm.
Is this something I need to refer for? Is this an emergency? Do I call 911? Do I send her to the ER? Or is this something I can treat? And so we're trained in that same way. Naturopathic medicine could be a little more challenging as foundationally doctors, once they move into residency, have choices. They need to go in some direction and specialize in an area. But I have patients that have been to neurologists, GI specialists, psychiatrists, so they've been to various specialists, and so I have to understand what their job is and what they do and what they offer. And then you could say from a foundational view, you could say, well, I'm not here to be alternative, but naturopathic medical doctors are trained to offer other alternatives. So I could say, well, we could do some herbal therapies. Hey, that antibiotic you're trying to avoid, let's try to use some vitamin A and zinc and vitamin C, some garlic and oregano. So we offer some potential therapies that are alternative to what regular medicine would offer, but we can still prescribe, in most cases, multiple prescriptions. So I use antibiotics when needful.
Wow, important.
And a lot of doctors, naturopaths may be opposed to that, but again, there are times when we have to assess, whoa, I think this is a serious infection.
Yeah.
I don't want this to advance, and I might even prescribe prednisone or certain things that just any typical primary care would do. But I have the option. I don't have one choice. I can look and I can have the conversations. This is one path I can do, but depending on how you feel and how you're reacting, I could do this too. And we work with the patient saying, what do you think is going to work and you need right now? The patient says, I don't know. I go, well, I think you need to do this. I think we're safe here. I said this the other day. I think we can do some ribs this time. But if any problems, you'll call me in the next 24 hours, and if it changes, we can do it different. Or, hey, this is really bad. I think we need to be a little more aggressive. I want to keep you out of the hospital.
Yeah.
So we do with that the same as everybody else, but we offer the alternative. A major way in which we differ, though, I think, is maybe in the mindset that in that alternative thinking, we do have a wider box, a tool set. And so because of that tool set, and maybe it's the tool set that makes us different. You say, well, if you said, I was a carpenter once in my younger years, so I used to build cabinets. So you could say, well, what if someone gave me a hammer and said, I want you to build me a full kitchen cabinet set? Okay, well, I can do a lot with a hammer. Yeah. But I might be limited in how good it looks and how well it holds up.
You need some more
But
tools.
here's some nails, and here's a tape measure and a pencil. Oh, okay. I'm improving. I'm increasing my tool set. I'm going to have a better looking outcome, clearly. It'd be like saying, I'm going to build a car with a single wrench, a 3/4 inch hex wrench. Well, you're only going to get so far, So we can imagine that everybody, when you build things and make things, and I'm trying to build in essence, a body that's 100% perfect, if that's possible.
Mm-hmm.
But even a race car, I'm not really satisfied with a sprint.
Yeah.
I want a full-blown NASCAR, 200
Yeah.
miles an hour. That's what I want from me and my patients. I want all the tools I can get. So we might be defining the fact that I can do a food allergy test, or I can do a gut microbiome study, or I can test for parasites. And I'm open to those ideas, meaning those are potential possibilities that could be affecting somebody. And if someone may have diarrhea, and I go, that may be due to a parasite, or they may not have diarrhea, but I'm still open to testing it. I'm not going, well, you don't have any symptoms of diarrhea, so I'm not going to go there.
Yeah.
I'm just saying, you know what? I'm going to test everything.
Yeah.
And so if I'm just being open to the possibilities. So if I might be defined by the fact more as a naturopathic medical doctor, as somebody who's willing to do whatever testing is there. And if a test comes along and says, hey, this shows me this, I'm open to that. Yeah, it's information I didn't have before, and it might be beneficial to the patient to go, hey, we found a new way to treat or evaluate you and treat you, and this could be helpful. Right?
That is unbelievable, and that's exactly what we need. If I haven't said this already, when parents come in to my practice, they come in thinking that they're looking for a diagnosis. And I have a conversation with them that, yes, in the system, we need to use a word to get to tools. But then through our discussions, we arrive at the absolute conclusion that parents aren't really looking for diagnoses. They're looking for tools to support those that they love. Anything and everything that they can identify that will allow their child to be happy, healthy, and successful should be on the table. And that's where I think the naturopathic doctor offers so many more tools. All tools potentially are on the table. And all of my parents, I try not to speak in absolutes, but all of my parents want access to any tool, not a narrow view of, well, if we call it this, it's this. Let's consider the entirety of what may be going on here, from toes to head, inside and out, brain to body systems, so that all tools are available. And I think that we have to be headed that direction in terms of our society and the way we look at medicine. I think, and I may be way outside here, and please correct me if I am, but I think historically, I think the naturopathic side was sort of, it's kind of an outlier alternative idea. But I think it is quickly expanding as mainstream because it has to be that way, because you have the medical side. So you can go that direction if and when needed, and if that's the best option for parents. But you're not going to overlook this idea that maybe there's an infection that we're overlooking. Maybe there's a virus. Maybe there's some vitamin deficiencies. Maybe there's some exercise regimen. Maybe there's whatever it may be. So at the end of the day, you have all the tools, and your point is so well taken. You can't build a cabinet with a hammer. You need all the tools. And so once again, I know we're headed that way. I just hope we get there sooner than later. Not to indict anyone. There's amazing people in all fields, of course. But I really feel like, particularly when I'm working with the pediatric population, that if we're not looking early on at what the source is, again, if we're treating a young man with ADHD with a stimulant, and he needed insulin all along, and now we don't need the stimulant, we haven't done that young man any favors.
Right.
And it's never the mom and dad's fault. It's not their fault, because they, we take him to the doctor, and it was never even on the table. We never even thought about it. But you, in this field, this paradigm isn't going to overlook that, and that's critical. Especially when we want to know the source and we want to use the best means for intervention. Any thoughts there?
I appreciate the thought and the sentiment. It's why I'm here, and we've talked about it in private conversations. I never intended to treat children, but they've come to me, and my treating my own child was a learning experience of going, I can do something here. And then recognizing, there's a lot of people in need. And of course, what I've seen in the last 18 years, and certainly the last 10 years and last 5 years, and a serious incremental increase in the struggles our children are having. It is off the charts.
Interesting.
And I'm thinking, it's a crisis. And it's and I don't think yes, there are no perfect parents, and yes, we can always improve on being better parents. And so, but I'm not blaming the parents here. If anybody, I'd blame medicine. We are failing to recognize that we have a problem. We're failing to catch up or keep up with what's happening and to figure out the root causes. And we are reacting and reacting not intelligently, just with what the tools we have, meaning we're
Old
throwing
tools.
a hammer at everything when it needs a wrench. And the tools mostly are stimulants and antidepressants. And that isn't really the issue. The child isn't deficient in Adderall or norepinephrine or dopamine or serotonin. They're lacking nutrition. They're lacking reduction of inflammation through diet or lifestyle or detox, if that's the case. And so we really need to get on top of this. What's going to happen? Just the financial cost of COVID is we're all aware of what that meant to economies and countries. This cost of our kids, of a third of our workforce having attention issues or autism or behavioral issues or brain fog or whatever. This is, imagine, we are way behind, and we need more doctors that understand this, that appreciate it, and can support and treat. And let's take care of these issues. Otherwise, we're going to have a lot of adults not leaving the home, independent. I look at my kids, and I think most parents are the same way. As a parent, I'm hoping my kids will grow up, become independent, meaning emotionally, spiritually, financially, being able to be on their own and create, right? Become creators themselves of little families, of solving problems in the world. But our kids currently struggle just to take care of their everyday needs and to feel present, not distracted. And so again, they're going to be dependent upon families. I mean, they won't be leaving homes. Not that we want them out of the homes. I love my kids. I love my grandkids. But I don't want to raise them until I'm 90 personally.
Right. But being in the basement at 35, maybe not.
They might like that idea, but we want them out and living life in the fullest way they can and feel confident and safe to do so. Right?
Yeah. So now, going to follow my brain, my very dysregulated brain, you open it up, and I don't know if you have a response to this. COVID. Are you seeing residual inflammation in the pediatric population from COVID itself? Is there just not enough data? I guess I shouldn't. I'll stop the question there. What are your thoughts there on what we're seeing in kids today and COVID? Whether it's the vaccine, the illness itself. Go where you want to go here.
And I'm going to say I don't know, and I'm learning, and there are some observations we've made. As one of the things we do in our medical office to help us to gather information, besides doing blood tests and urine and stool tests, we also look at the brain, and so we do QEEG brain mapping. So we look at the electric activity of the brain. That brain activity gives us patterns associated with delta, theta, alpha, beta brain waves. What we do see in the last 4 years, more than I've seen in previous years, is a lot of slowing in the brain.
Interesting.
A lot of, again, low energy, as if the brain's lacking oxygen, lacking nutrients, mitochondrial activity. We've correlated that with some increases in Lyme disease and Bartonella in the same time frame.
Wow.
And so we think that could be creating an issue. But a lot of that's shown up since we've seen COVID. In my adult patients who we diagnose, meaning to diagnose COVID, currently in the U.S. there is no current approved, covered through insurance blood test to evaluate for long COVID. And long COVID is a condition in which people had COVID, and then they've ended up with residual or ongoing symptoms such as fatigue, brain fog, many other conditions. Even right now the research shows increased rates of cancer, increased autoimmunity across the board.
Unbelievable.
And so it has changed the immune and environment, certainly in medicine for sure. Yet we don't know how to evaluate it quite yet. We don't know quite how to treat it. There's ongoing research of different things that have been helpful. That's a whole nother conversation. When we look at the kids, these patterns of the slowing we're seeing frequently in our children as well. And so in our recent research and evaluation, we've considered things such as even hyperbaric oxygen and even photolight therapy, so photobiomodulation, which is in the research for 30, 35 years for increasing ATP, mitochondrial activity. Cool.
Yeah.
That we could put a helmet on. Now, these things weren't available outside of research, 25 years ago, 20 years ago, 10 years ago. But today, people can have helmets they wear at home. And we've been experimenting with doing light therapy into the brain and evaluate, pre and post brain maps to see if that energy comes up.
Wow.
Now, we're seeing benefit in some. We're adding other things and other nutrients. I'm a naturopathic physician, so I'm adding ginkgo biloba, which increases oxygen to the brain. Ginkgo biloba is great.
Yeah.
It's so good that it's banned by the Olympic Committee. You will lose your gold medal if you're using it, right?
All right.
It's so effective. We're using L-arginine to increase, right? Nitric oxide.
Yeah.
Nitric oxide important in dilating blood vessels and improving circulation of blood through the body. So we're using natural medicine while applying then external research therapies like hyperbaric oxygen, photolight therapy, and of course neurofeedback. And so those therapies are enhancing. So yes, we do think, so to answer your question simply, we do think there's been an impact. How it's affected kids, it's difficult to know.
Yeah.
But it is, we know this from COVID. The research is very clear. It's creating inflammation.
I was just
There's
gonna say,
the topic,
inflammation.
say, what's our topic today? Maybe it's inflammation, but so many things create inflammation. And it's just sort of piled on all the other issues. So if the child had Lyme or Bartonella or food allergy or strep, or Pandus or whatever it was, it didn't help it.
Yeah.
And so it's something that has possibly compounded the issues we're seeing and could be correlated with some of the reason of the increase. Although, again, I think the studies are still pending. But if you look at the research carefully, which I do view it, but I haven't dug into it 100%, but there are studies on adults and children, and you'll see the rates increase across the board on all things since COVID.
So they really are. I mean, legitimately studying this, and I would say that from the standpoint of, do we need to do more?
Yeah, probably.
Okay.
Right, probably.
Because I have seen in my practice impact from, the kids I saw pre-COVID and the kids I see now. There's some correlation with the experience or the difficulties the kids are having now that in terms of a positive relationship with symptoms going up. I'm more likely to see
fascinating.
Attentional issues, motivational issues, learning issues, sleep issues. And so can we draw a one-to-one correlation at this point? We certainly can't. But if we're not looking in the right places, if we're just sort of dismissing these things, and we're not actively pursuing the sources, then we're not doing what we need to do to support those that we love and create that human experience that everyone deserves. Everyone's got to put in effort. Everyone's got to struggle a bit in life, and everyone's got to persevere to get to success. But at the end of the day, really, the goal should always be what tools are needed so that an individual, when they do put in that effort, achieve the success they deserve and has the health they deserve. And so I think your field is leading that charge, and I think it needs to be expanded even more. So as we sort of round the corner, and my goodness, I hope to have you back 50 more times. We could go on and on and on. It's absolutely fascinating. I feel honored to have just locked you down for this time just to ask you questions. These are things that I really am interested in, and I know everyone is. So if somebody comes in, I know it's always different. There'll be variabilities here. Each situation is unique. But if let's say a parent brings a 10-year-old and is diagnosed with ADHD, what happens when they come and see you? What is their experience going to be like? What kind of tests might you run? I'll let you take it from there.
Well, each child is different, and of course there are some big things that we're focused on in children. And of course ADHD is one of them, with impulsivity, a lack of focus and attention, follow through. We have autism, we have potential behavioral issues, which could be PANS or PANDAS as well. We look at the behaviors, we look at what the parent's saying. All right, what's going on? And we try to decide, is this behavior that you're reporting or this challenge you're having, does it seem irregular? Hey, is this what everybody else is experiencing? Yeah. Maybe it's a young mother and she says, my child's doing this. And I might say, well, all children do that. Or I may say, that seems like that's a little bit irregular. We have some delay in speech. Okay, a lot of kids some speak a little quicker and some may be delayed and some are not speaking at all, even by the time they're 3. And that's a concern. So we'd evaluate it as that seemed to be abnormal. So from that point of view, then I start to talk about and look for other clues. So maybe the child comes in and say, we have some behavioral issues, and also the child's very hyperactive, and they're even oppositional, and they seem to be very grumpy and irritable all the time. And I say, well, what other symptoms do they have? Oh, they have eczema. Okay. Well, eczema indicates probably a potential food allergy or food allergy to food additives. All right, so we're going to do a food allergy test. Well, that kind of covers if we can look at the gluten or dairy in the diet as a way of triggering attention or hyperactivity, and we can look at those foods as a way to evaluate the eczema. So we start looking for other clues as well.
Yeah.
And those clues and the layers
Yeah.
begin to point us, all right,
Yeah.
you know what, in this case, let's really focus on the gut. Now, I generally do start with the gut on nearly everybody, and that includes my adults, meaning we look at the foods, we look at the bugs, yeast and parasites and bacteria and viruses, but we're looking for the clues, and hopefully it will pinpoint even a specific test. Hey, for example, I did see a child the other day, and it was about, again, a form of autism, right? And just different challenges the child was having. And I said, I might want to do a food allergy. And then as we're leaving or stepping out of the office, the mother says, oh, how about the eczema? Okay, we didn't talk about it. I said, let me see what that is. I'll go, oh, I see some dryness and some eczema. I want a food allergy for sure now.
Yeah.
So that's on the list.
Yeah.
And so again, we begin to evaluate, and we try to be thoughtful, conservative. If you did all the testing I had, it'd be a few $1,000s. I don't require that. I would love it sometimes. Let's just do it all.
Yeah.
And some parents and patients are willing to do that. But we just begin to evaluate and try to find those things and start to investigate in ways.
Yeah.
And as we find things, we implement those treatments, and then we follow up with those. And then if we're plateauing or not getting result, we investigate further.
Yeah.
And we just keep investigating.
Yeah.
And following a plan or model that starts with the gut for me and the immune system and inflammation as leading targets.
Yeah.
Right.
Wow. So again, it's just considering any and all options, and then kind of following parents' leads. Kind of shining a light, like it looks like we're over here. And
Showing the options,
yeah.
And then we decide what we want to do,
Yeah.
how much we want to investigate, and then start putting things into the diet, the detox, focusing on the gut, and we see how the child responds.
Yeah.
If a child's not responding, we investigate further.
Yeah.
We do more labs. So.
Do you have occasions where a child comes in and they are on the more traditional psychotropic or psychiatric medications, and through your investigations and your therapies that those are no longer needed? I know you can't speak in general terms, but I'm curious about that.
And I'm not against any of the medications. We'll say that they are helpful and needful in acute situations. Yeah. And some people have some genetics where they seem to do well on an antidepressant long term.
Yeah.
We accept that. We acknowledge that.
Right.
And we don't want to fight that if that's what's useful and needful to the patient. But oftentimes, once we start cleaning up the diet, and more even, there are multiple, like we have 2 books written by 2 Harvard psychiatrists, both focused on the idea of the keto diet in adults for mental health, depression, anxiety, bipolar, showing great benefit. And we know that, and again, so this idea that the gut and the brain axis is connected, and even modern medicine or traditional medicine and psychiatric and medicine where we might traditionally use medication, start recognizing maybe we should try a dietary intervention. The thing is, as you do that, you have to evaluate carefully, and you may have to cut back, and in some cases you're able to remove completely from the plan the prescription medication that was once needed.
So important.
And so, yeah, that's something we evaluate and we can do. And it's not like we're there, hey, we're going to take you off all these meds. They're bad.
Yeah.
No, it's about, let's find what works for you.
Yeah.
Based on your genetics and your environmental issues and immune issues and gut issues and so on.
And that's how it has to be.
It's an individual journey and process.
Yeah.
What works best.
Yeah, and it's always individualized.
Yeah.
Yep.
Many times we can treat without necessarily medications. But there are times when I'm like, you know what? We're struggling here. I'm going to give you a low dose of an antidepressant. Let's see if that helps. Oh, that helped. Great. We'll just leave it there.
Yeah.
We'll keep doing what we're doing.
So you legitimately have all tools. Everything is available to you. You have all the options in the toolkit, which is critical. And I'll just speak for myself, not being a medical doctor, not giving medical advice. But what I tell families is, medication shouldn't be taken out of the calculation in terms of an intervention. However, it really should be the last consideration. We want to look at the big 4. We want, as I see it, we want to look at diet. We want to look at sleep. We want to look at exercise, and we want to look at sensation, and then you follow up with the physiologic piece. In your field and paradigm does that. And then if we're still not getting to a human experience or behaviors that are adaptive, and for me that threshold is if an individual's internal state, whether that's their brain or their body, can't be corrected through the more natural mechanisms, and that's impacting their sense of self, now any option's on the table.
Correct.
But the reality that you have all those tools available is so critically important, and I think that's what really parents need, and really where we should be starting. So that's phenomenal.
Yeah, well said.
Well, a couple more questions as we round the corner to actually closing it down. You see my brain all over the place here. This came from a member. What are your thoughts, controversial as it may be, on vaccines and well, I guess the question really was, pregnant mom, what would the recommendations be around vaccines once my child is born? What is your stance on that?
Well, this certainly is controversial, and we're not sure where the controversy comes from, but let's describe it this way. Very recently exposed was the idea that the CDC suppressed information that vaccines were causing harm, autism. This is in 1999. Now, it was released and discussed then, and then it was suppressed and denied, and they've admitted it recently. This is in the news. You can Google it. And I think the problem is sort of in our country, we've developed a way of conversating that you've got to be on one side of the spectrum or the other. And I think we've got to stop that kind of rhetoric.
Couldn't agree more.
What we need to do is come to the table and go and recognize that, when I was a child, I had 7 vaccines that were recommended, and now that's 72 for our kids before the age of 18.
Oh, my Lord. Yeah.
Now, is there a difference there? Absolutely.
Yeah.
Now, to say that vaccines don't cause harm is kind of absurd.
Yeah.
We'd have to say then, do any other medications or interventions that doctors do cause harm?
Yeah.
No. Well, we know that's not true.
Right.
So how can everything else that we do potentially have harm? Mm-hmm. And one other thing we do never cause harm. Mm-hmm. Well, that's not logical, right? And everybody would understand and agree with that.
Yeah.
And we know that we all accept that, and the government accepts that vaccines do cause harm. That's why we have the vaccine injury hotline, right? You can call, and we're supposed to report when a child is harmed by a vaccine. Those things are all set up. What was taken away years ago was people couldn't sue or hold the pharmaceutical industry liable for injury, and that was set up, and that's being challenged right now, right?
Good.
And we think that's good. Now, the question is, I feel like, and these are opinions, and the reality is we have no research, so all we can have is, anybody can only have opinions at the moment, so these are my opinions. I don't think that I'm not against vaccines. Certainly polio seems to be a nice thing to avoid, or tetanus would be a nice thing to avoid. So I'm not against vaccines. I think we need to evaluate and ask the questions. One is, who is at harm of being injured to a vaccine? And if we could do that kind of research and ask those right questions, and now through my experiences in natural medicine, I think I can predict those patients on my own better today than I could 20 years ago. And we can evaluate those families and say, you know what, this child could be at harm. Let's wait until they're a little bit older to provide these vaccines, and let's do one at a time or just one shot at a time. It may be a combo like MMR for the measles and mumps and rubella, but we can evaluate that and do it carefully and slowly. Do I ever think that we need 72 vaccines over a lifetime? No. I'll never agree to that. I think that the immune system, we have survived thousands of years without vaccines. Yes, we've eradicated certain things that are potentially life-threatening and damaging to our bodies. That's great. And so I think we need to find that balance there and recognize that the pharmaceutical industry's push, for example, Hep B, which has been evaluated for causing harm, I'm not a fan of that.
Yeah.
That's a $1 trillion industry, that one vaccine. If we stop doing it, they lose $1 trillion. So the motivation there to keep it there is high for the one end.
Yeah.
But the desire to avoid harm for the other is here. But I don't know if the other side's ever going to agree that they want to let go of $1 trillion of profit. So we need to find that balance. But I think parents need to be advocates. medicine needs to let go, and really too, as you recognize, the doctors stand as arbingers to health care, but two, it should be a team membership. When a parent comes in, we're here to help you. I'm not here to close doors. I'm here to open doors and create opportunity, and I'm not going to block you from doing anything. But doctors have said, and become like as if we're protecting the pharmaceutical industry. We no longer can protect them. We need to be team members with the parents and protecting the interest of our children. We're not doing that now. And I'll call medicine out. We're not protecting the patients. We need to stand up and protect them, meaning we need to say no when it's going to be harmful, which means we need to be educated, informed, and understand that it does cause harm, and honest about it.
Yeah.
Right?
Yeah. No motivations.
No motivations.
Honest. What does the data show?
What does the data show?
And not be afraid to
not
look
be afraid.
At what are the correlations here?
And step away from what we were told in medical school.
Yeah.
When I step out, and when we step out as doctors, once I start practicing, pretty much everything I just learned the previous 4 years is out of date.
Yeah.
It is now malpractice.
Yeah.
So
Wow.
in other words,
Yeah.
we have to stay informed.
Yeah.
And just because I learned something and someone said something to me in medical school or when I was a young doc, doesn't hold true. It doesn't have to hold true for the rest of my life. And we hold true to those things as if they are, the truth forever.
Yeah.
And that's not the case.
Yeah.
Many things change all the time, as we know, in medicine, and we learn something that one time was determined safe and is no longer safe.
Yeah.
So I think we need to be open, and it's going to, hopefully, we keep learning about that. Until then, we need to say no a lot more, I think, in the moment. That is my opinion.
You are the perfect guest and a fascinating individual. Absolutely amazing. The entirety of the Understanding Exceptional, which is the project that I'm continuing now, is really information sharing and having honest discussions and not being afraid to say, well, there seems to be a correlation. Anecdotally is all I have. I can't give you hard data, but I have so many experiences with families where a vaccine was provided, a fever was spiked. We know vaccines cause inflammation. A fever was spiked. Maybe there was a seizure, but everything changes. There's a direct line to be drawn between the vaccine. That doesn't mean we shouldn't do vaccines.
Doesn't mean we shouldn't do them.
But we should also be honest that also we shouldn't also just categorically say no, it's not. It is not that. We have to be willing to say, what is it? There is a correlation here. Why? So we can help people. Who's at risk? Who's at greater risk if we do administer the vaccine to have experiences those changes physiologically, neurologically, and this is how if we're ever going to identify the causes and therefore the cures, we have to have open, honest discussions that have no motivations, financial motivations, political, whatever it may be. The motivations always need to be what is happening in the human body. How do we promote the best human experience? And I think you articulated that beautifully. Did anything to add there?
And we could get to that point where we could say, you know what, a vaccine, and we'd have to admit it. We'd have to say it. Mm-hmm. Hey, I'm gonna recommend a vaccine. We want to prevent polio. We want to prevent tetanus. We want to prevent measles. I'm going to give you a vaccine, and there may be some injury or harm here, and this may affect your child's brain by increasing inflammation and irritation. That's what they do. They excite the immune system. And that may be too much for your child and their brain, and it may inflame, and it may increase the risk of autism. Mm-hmm. We could say that. Mm-hmm. We can't say that now, right? But we could say that. Yeah. And then but we're going to have to come up with the answer is, what do we do in that case? Yeah. And the parent has to decide, you know what, I don't want that, but I don't want that either. And so, all right, but if we can have the right conversations, then we can investigate, and then we can evaluate what could we do. Mm-hmm. And for example, it could be simply as we do the vaccine, and I give the child a Benadryl or ibuprofen, or I do a glutathione IV to keep the inflammation down in the body, so we can help them detox appropriately so that they don't become inflamed. It could be that easy of an answer. And yet, if we don't have the right conversations, we'll never answer. Yeah. How do we prevent it? Yeah. How do we reverse it if it happens? Yeah. And so we can't get to the solution if we can't agree that we have a problem. Wow. And right now, the conversation is, it's not a problem, it is a problem. Yeah. And so we need to come to that and have the conversation. It's a problem. How do we evaluate who is at risk? And then what do we do when someone is at risk, or if we did something in it and we didn't know, how do we reverse that? And we could fix it. I really think it's a fixable issue.
It absolutely is. But it's going to take all of us, and it's going to take a paradigm shift.
It's going to take a paradigm shift.
It's going to take
a conversation shift.
Yep. It's going to take academia to acknowledge some of these things. We've got to get rid of this idea that there's that the protecting financial interests, absolutes. We got to get rid of the culpability. If you have no culpability, then
There's no
there's no
accountability.
risk at all for
Yeah.
accountability, right? So well said. Oh my God, just a fascinating conversation. So one more question before we wrap up, and I sincerely hope that you'll come back. So this is something I call the blind side here. So I kind of gave you an outline of where we might go today, but we took some turns, which they were fascinating. So last question here. You have to pick a number between 1 and 4, and I'm going to ask you a question.
Number 3.
All right.
Makes me nervous.
Yeah, it should. Here we go. Did you play sports growing up at all? And what sports were those? Did you play in college? What was your athletic background?
Fascinating. I never did play on any team in high school.
Really?
I tried out for the tennis team at Mesa Junior in
All right.
Mesa, which is now torn down and doesn't exist. And I was the last guy cut. And now, if I hadn't been, I could have been a tennis pro, but probably not.
But that's awesome.
Being involved in my community and local church, played a lot of basketball and softball, and in those days we played every day. We were out and that's a different thing. That's different from our kids today. We played outdoors. Every day we'd come home, and if we had homework, we got it done. We got out there and we played.
Yeah, you were outside.
And that's one thing we're missing in our kids today. We see so few getting out. But I had a great childhood playing sports and enjoyed it.
And you're so healthy and fit. One of my questions was what's your workout regimen? Maybe we'll save that for next time because you're such a fit human being. So again, just unbelievable information, and we only scratched the surface. But for anyone interested in coming and seeing you, can you tell us a little bit about your practice itself and where they can reach you?
Well, one way to look at our practice is to go to our website at eastvalleynd, as nancydavid.com.
All right.
Naturopathic.com.
And we'll put that a link down below here.
And you can our information address and phone number and email us. And so that's a great way you can talk to my staff. They're very well trained to know if you share with them what's going on. They'll make suggestions on what doctors to see, how we might approach evaluating, setting up an appointment, and if it's something that we treat. Obviously, many things are written there, but my staff can guide and say, no, and if there's something that you bring up and go, well, we'll ask Dr. Porter, and they'll send me questions, hey, do you treat this, you know about this? And I'll say, no, let me investigate, or yes, I've seen that, then I can probably help with that.
That is great.
Right? And so we'll do our best. Our goal is to help.
Yeah, go check them out. You will not regret it. Dr. Porter, it's been an honor and a pleasure and so interesting. I can't thank you enough. This has been Understanding the Exceptional Mind, and can't wait to see you on the next video.